Hello, class. Professor Cisneros here. Week 3 wrap up, and next week there isn't a discussion board, but assignment 1 is due on Sunday. Talk about that in a minute. So, week 3, starting to get a feel for what a study budget looks like, getting the spreadsheet, and looking and adding. So, you had a basic spreadsheet or budget on a spreadsheet, and you were to find and identify 5 additional items either from your reading or from your own experience. The spreadsheet that was included was pretty extensive, but everybody did a pretty good job of finding and adding a few things to it. There were some people that didn't quite look at the entire spreadsheet because the obvious things like data management and stats, those things were already included on there. But at the same time, adding something like office supplies, while it sort of makes sense, I guess from one standpoint, that's getting a little too specific because something like that is going to be covered in what they call the overhead. So that's going to be a percentage of the budget that is just added on top of it to cover a lot of those other small expenses that those at the site are going to experience and would not experience unless they were doing research. So office supplies would definitely fall under that. Private institutions, so private offices, doctors' offices are going to tend to have a lower overhead rate than, say, larger institutions, say, I don't know, like the Mayo Clinic or the University of California system. Large hospital systems are going to have a rather high one, certainly much higher than a private office. A private office can range anywhere from, say, 20%. I've actually seen some as low as 10%, but that's very rare, and those tend to be smaller offices, and the personnel are not usually dedicated to actually doing research. So those tend to be much lower. But on the whole, it's usually going to be somewhere in the 20% range, maybe 25. Like I said, over the years, I've seen that number increase all the way up to institutions where I've actually starting to see up as high as into the 40% range. And you just have to be careful with that. The overall, what is in a budget is going to be dictated by the protocol and going to be somewhat site specific. Some will include things like charging for reviewing I&D safety reports or SAEs, all the work that goes into it if there are audits. As a company, as a study team, you just have to weigh those types of items and make a decision for yourselves as to whether or not and how much you want to be paying for that. It used to be frowned upon if a site had requested, say, money to attend an investigator meeting. But now I'm seeing where it's becoming a little bit more acceptable. Again, it depends on the institution. Some of the institutions, it depends on the company. Some companies that have been around for a long time and are not used to paying it may be a little bit more resistant than some of the newer ones where it's just somewhat more common. Then, of course, there are the amounts. So again, specific to the team and the site and the protocol. So in the post, you were to discuss the importance of developing a good budget for the company, and then the ramifications of being over or under budget. The importance of for the company is fairly easy. Every company just needs to know how much money they're going to spend and into what buckets. And it's important from just a management of the company. You need to know, just like your household budget, every company needs to know approximately how much they're going to spend over a given year, and that includes studies. The ramifications of being over or under, and these tend to be extreme numbers. So if you're over or under 10 or 15%, or even depending on the size of the study, and you start looking at absolute numbers, even at 20% range, it's usually not the end of the world. And of course, How far off will depend on how often you update that budget. The number of studies within a company, some will be over and some will be under. And I think from a company standpoint, they tend to think that it'll and hope that it'll even out. So let's say that they expected to spend, I don't know, let's say $50 million in studies. Some were $1 million over and some were $1 million under. At the end of the day, you're still at 50 million. So it comes out on the wash. You still want to be somewhat closer than that, but from a company standpoint, it's not that bad. Now, if you are grossly underspent, that is that let's say that you spent you're underspent by 25%. So you spent 75% of what you expected to spend. That can be serious because that is 25% of your budget that could have been spent promoting something else, going to other study-related activities, and that time is lost because it was tied up in your budget. And so that's the ramification of being under budget. Of course, if you're over, it's fairly obvious that the company will need to find the additional funds to be able to continue to support your study. Sometimes these things are beyond your control. There are some studies that, let's say oncology studies, that enroll very, very slowly, and so it's difficult to anticipate the speed at which you're going to be enrolling. And the opposite is true. Sometimes enrollment goes much, much faster. And unfortunately, a lot of people think, well, that's a good thing that we're enrolling much faster. That means that we're going to save money in the long run. And while there's some truth to that, the FDA can look at a study that is enrolling much faster than anticipated. But if you're not able to keep up with, say, the monitoring, then it can be considered to be out of control. Because then there may be safety signals that you are failing to pick up because you're not monitoring fast enough and not looking at the data quick enough. Not to mention there's going to be a much greater spend in investigator payments, increased frequency of monitoring. So all of that goes up, and that can be considered to be completely out of control. But again, those are the extremes. If any questions about that, please by all means reach out to me. So getting back to the assignment, so next week your first assignment is due, and this is going to be a senior management presentation of the clinical trial enrollment action and performance monitoring plan. And essentially what you're doing is you're going to be playing the role of project manager, Deidre, and putting together a PowerPoint presentation talking about how you're going to boost enrollment for your study. Now, all of this has to be evidence-based. Always keep that in mind. And what you're going to do is you're going to put the PowerPoint presentation together. You're going to upload it into VoiceThread, and then you're going to narrate as if you're actually doing the presentation in front of your senior management. In addition to that, you're going to be uploaded into Grade Center, so that way I can take a look at it and obviously attach a grade to it. It's fairly self-explanatory, but again, if you have any questions, as always, reach out to me. Otherwise, I look forward to seeing you on the discussion board and looking at your upcoming assignment. Thanks.